What's up, team? I'm putting together a little video to help you with ankle mobility and lower body warm-up before you are squatting in the gym, before you're doing jiu-jitsu practice, before you're going for a jog. Minimal equipment required. You can see I'm doing this at home with a little makeshift pole I pulled out of one of my closets and some anatomy books that I'm putting to good use. So you don't really need almost anything to do this. You can do this without the books and the pole as well. I'll show you some variations at the end that you literally just need your body and a wall. But there's lots of ways to warm up your ankles and your knees and your hips, but this can be a really good way to get all that stuff loosened up, get some blood flow through them, get them feeling good before you go do whatever that activity is, especially if you're having hip pain or knee pain or ankle pain when you wake up in the morning or before you do your activity. So from the get-go, I'm starting with a variation with my foot up on top of a book. I'm going to get into the details on why I'm doing certain things the way that I'm doing them, and then you guys can decide how in the weeds you want to get. So first thing I'll point out is that I don't really have much for footwear on. I just have socks on. So I like to do this with as little like cushioning or support under my foot as possible. And that way I'm not compensating by turning my foot in or out. It's forcing all the mobility to come through my ankle joint mostly. So that's why I'm doing that. I'm also not doing it on a soft surface. So sometimes they have those like balance foam pads that are really squishy. I would recommend you do this on some sort of a hard surface that doesn't have a lot of give to it if you can. What you'll notice here is that I'm doing the activity first with the pole in my right hand and using it as support and balance. Then I switch it over to my left hand, doing opposite hand, opposite foot. So if I have it in my left hand there and I'm doing my right foot for the balance activity, that would be the easiest version. The initial version would be next hardest, same side, hand and foot. And then you'll see I get rid of it, and that will be harder than having the pole at all. So the pole helps with balance, but also helps with strength. If you're having trouble when you tap your heel coming back up, the pole can allow you to get out of that bottom position that's a little bit more vulnerable. What I'm doing here is I'm lightly touching my heel to the ground, counting that as a repetition and coming all the way back up. Allows you to work on some balance, but mainly I'm working on driving my knee over my foot, my knee over basically my second toe, and then I'm trying to keep my heel down without my foot coming up. So next, you'll see me do some stuff to the side. We'll come back to that in a second. But I'm going to go to the variation where I have no books under my foot. So this is, no equipment needed. You can just slide your heel forward on the hard surface and then drag it back to you. You don't have to slide it if you don't want to. I found some lint on myself. You don't have to slide it if you don't want to. You can just like let it hover over the ground and then lightly touch when you get to kind of your limit. But again, I'm going down nice and slow, trying to let that knee track over my second toe. If you do have knee or hip pain, let's say your right hip or right knee or right ankle are bugging you, you'll probably find that side a lot more challenging and you'll probably need more assistance, especially when you get started. So don't be afraid to use that assistance of the pole. One thing that you can do, I'll see if I can find a good instance of it, is as you go down, you can let your hand slide as it starts to feel easier. Slide up and down versus holding it really firm in one spot. That's fine when you're getting started, but the sliding can give you the confidence that the pole is there for balance without you having to use it for as much assistance. It can just be kind of a confidence booster. So usually I'm doing like 3 sets of 10 to 20 reps on each side, and then I'm switching. So you can see I'm going straight forward here, right? So my foot is coming straight out in front, and then I'm driving this knee over my second toe. Now, if we go back to what we were doing, the next version that you can do, which targets the glutes a little bit more, it's not quite as aggressive ankle mobility and warm up for the knee, is if you turn to the side and you actually just tap laterally, which just means out to your side. So now my knee doesn't have to track as far forward, but that glute has to work a little bit harder to stabilize because I'm going in a different plane. And then finally, I can try to tap my heel backwards. And you can see, again, I'm trying to keep a good arch in my foot, trying not to let my toes or my heel come up, trying to keep that foot firm on the ground. And I'm tapping backwards. So I'll usually do 2 sets forward, 2 sets to the side, and 2 sets back. If you just want to do 2 sets of 10, 2 sets of 10, 2 sets of 10 for each side and each way, that's usually an amazing warm-up. You're doing 60 reps each side. They're not huge motions, so it's not like you're doing 60 reps of push-ups or 60 reps of squats or something. They're tiny little heel taps is what I call them. I use these with a ton of my physical therapy patients. And as I scale them up and I put something under my foot, they still work really well because you can make them harder by putting something under your foot. You can see my heel wants to come up there, but you can make them harder by putting something under your foot, and you can scale them to be more difficult for you over time. And eventually you can hold on to some load in your hands as well to make them harder. So these are an awesome way to warm up your knees and hips and ankles. If you have a side that's been giving you trouble for a while, you're going to find that you've probably been compensating, and those muscles have been weakening, either in your glutes or your quads, or in your ankle. The muscles that cross your ankle, like your soleus and your gastroc, aren't really doing nearly as much here, other than a little bit of control on the way down. It's mostly your quads and your glutes that are working, but you'll notice the side that's been bugging you is going to be way weaker, and have terrible balance. So what you want to focus on without getting super frustrated right away is just getting a lot of small repetitions in the easiest way possible. So if it's just on the ground and having a pull for support, do that, and then just even if you want to do just one set the first time, and then building the number of reps and the difficulty as you go over time. If you're not sure how to build the difficulty, reach out to me and ask. Again, that's just like a little demonstration there of how to do it out to the side. Trying to let that knee track pretty much straightforward, and then I'm tapping out to the side. So just a little bit of a different task that you're asking for your glute there. And then finally, you can see me going back here. All right, so we're going back. The backwards tap. So I'm kind of hinging at my hip and tapping back behind myself, trying to keep my toes up off the ground so that my heel is what's tapping. And then finally, you can do it with the wall here. This one requires way less balance. It's a lot more of just a stretch through the ankle, which I still really enjoy. So I'm trying to hold that bottom position for a second when I get there, and then coming back up out of it, hold, just lightly touching this heel as far as I can get it. And again, hardly any balance needed because I'm putting my hands on the wall. So it's really just taxing on my quad. It's still some work for your glute, but this is a lot more quad focused, working on opening up that ankle for anything that you're doing. So if you've been having trouble with ankle mobility, I've got one side that's messed up. After I hurt my ankle and knee in jiu-jitsu, I'm kind of getting it back to the strength and mobility that it used to be at. So this right side that I'm doing right now is a lot better than my left side. If you could see, let you see it. As I'm doing my right side, I can easily touch my toe to the wall. I have the mobility to do that. And then once I line my feet up and I swap my feet, you'll see that my left ankle, it's a real struggle for me to get my right foot all the way to the wall. And I really can't even do it without my heel coming up. And so when you're lacking that motion in your ankles, you really wouldn't know until you really push them into that full range. But you get into that range of ankle mobility as you're going downstairs, as you're getting up and out of a chair sometimes. If you're doing any squatting, if you're doing running, if you're doing jiu-jitsu, you get into all these different types of positions. And if you're compromised in terms of your mobility, that range of motion is going to have to come from somewhere. And a lot of times it comes from some awkward torque on your knee, or your hip and low back having to compensate in some way. So this is an amazing way to warm up your ankles and your knees and your hips before you train with almost no equipment needed. Again, as you want to make it harder, you can elevate your foot. Once you get to about 6 to 8 inches off the ground, and nothing under your heel to make it easier, that's a good time for you to start to add a little bit of load to your hands in the form of just nice light dumbbells, and then continuing to progressively overload that way. So once you get to elevated with weight in your hands, or a really like light barbell on your back, you can start to push it a lot harder from there. But that is how you would start to scale it up to be like something you can progressively overload. So it goes from handheld assistance to basically just letting your hands slide up and down the handheld assistance, to getting rid of it and doing just plain body weight, no assistance. And then you're going to add load to it a little bit over time. So if you guys have questions about how to scale it, I'm going to add a description of like a sample recommended plan for number of reps and sets that I was chatting about below. And then you guys have this video for reference for actual technique.